We'll start by looking at the vertebral column. So we're looking at all of the axial skeleton. Remember, axial skeleton functionally is the central core skeleton, its main function being structure and support. So we talked about the skull in week one, and then now we're going to look at the rest of the axial skeleton along with the brain. So the vertebral column being the spine, the stacked vertebra that protect the spinal cord. So internally, you're going to find the spinal cord traversing from the brain where the medulla ends all the way down to the end of the spinal cord. If we look at how the vertebral column is formed, it's various vertebrae. Each of them have an opening or foramen, and then they create a tunnel-like structure where the spinal cord can run. Now, it's going to help support the skull on top, obviously the weight of the skull, and then it's going to help also anchor the ribs to support the chest and thoracic cavity, and then that's going to help support the abdomen as well as the limbs by way of the pelvic girdle, the pectoral girdle. So it's really going to help be the axis where all of the body movement can happen. All right. It's going to be divided into 5 regions. So from the proximal or head region, we have the cervical vertebrae. These are 1 through 7. These are going to be much smaller, and we'll talk about some of the unique features like the transverse foramen that are found here. Then we have 12 thoracic vertebrae. So this is going from T1 to T12. And the unique quality here is that it's going to be anchoring the ribs. So this is going to create the barrel shape or the chest or thoracic cavity. Then we have 5 lumbar vertebrae. So these are going to be having very large bodies. One of the unique features of the lumbar is that they support the weight of most of the body, right? The limbs and the upper trunk. So these have very thick bodies and a larger 1 through 5. And then the sacrum is fused. So these are 5, but they're fused as one structure called the sacrum, and the coccyx being 1 to 3, also fused as the coccyx or coccygeal. All right. Let's talk about a typical feature found in every single vertebra. So they all have a body, although some of them, like the cervical ones, have much smaller bodies, and some have an absent body, like C1. So the vertebral body, they all have a vertebral foramen. This is where the spinal cord is running. They have a superior articular facet where they anchor to the rib, the vertebra above, and then inferior articular facet where they anchor to the vertebra below. They're also going to have transverse processes, which sort of stick off to the sides. These also help to anchor the ribs in the case of the transverse vertebra in the thoracic region. And then the spinous processes also project but outwards towards the back. And this is going to be a point where some of the ligaments that hold the spine together run, the supraspinous ligaments that run atop each of these spinous processes. So these will all be attachment points for ligaments and even some of the muscles of the back. Let's look at the facets. So the inferior articular processes are going to articulate with the superior processes and create this opening. This is called the intervertebral foramen. This is where the spinal segments from the spinal cord will exit. So at every level, we're going to find the corresponding spinal segment, right? So at the C1 vertebra, we're going to find the C1 nerve. C2, we'll find the C2 nerve, etc., all the way down towards the sacrum. Let's look at some of the unique features of each vertebra. So starting with C1. C1 has no body, right? Most of the other vertebrae have a body. Lumbar ones have really big bodies. And then the C1 has an absent body as well as no spinous process. So posteriorly, it only has a tubercle, which is a much less sharp projection. And so these are some of the unique qualities of C1. So C1 is the atlas, and it's going to articulate with the occipital condyle. So we talked about that feature of the skull, which sits right on top of these facets and creates the atlo-occipital joint, which is basically anchoring the C1 atlas to the occipital bone. C2 is also unique. C2 has a dens. This sort of sticks upward where the absent body of C1 is, so it goes right through that opening. And it's basically what allows your head to rotate. So it creates the circumduction movement of the skull which is what gives rotation, as opposed to the occipital joint, which is where the skull is at with C1. So there's no rotation at that joint. Instead, the rotation is here because of the dens. Let's look at some of the cervical vertebrae. They are also unique, C1 through C7. They actually have this opening on the sides. So they create a foramen because they each have a transverse foramen, which we don't see in the other vertebrae. So this creates a tunnel for the vertebral artery. We're actually going to talk about the vertebral artery later on when we look at the supply to the brain, the blood supply to the brain and the circle of Willis. So the vertebral arteries are branches of the subclavian artery, and then they run in this tunnel to actually go up to feed the brain. So we'll talk about that artery, and this is the opening where they run. Moving to the thoracic segment, these are going to have 6 costal facets. Again, they're going to have 2 additional facets that articulate with the ribs in this region. So 2 superior costal facets on each side and 2 inferior costal facets on each side that will create an attachment for the head of the rib. Okay, we're also going to talk about the ribs, and we're going to talk about the head of the rib as well. If we think about the costal facet for the transverse process, this is going to articulate the tubercle of the rib. So this is another articulation point, but it's on the transverse process. And this creates an attachment which secures another part of the rib. So we'll talk about the head of the rib articulating at the costal facet, the superior and inferior, and then we'll talk about the tubercle of the rib, which articulates with the transverse process facet. Let's look at the lumbar region. So 1 through 5, again, these have really large bodies, right? This is one of the unique features. The body's not only thicker, but it's a little bit wider as well, sometimes heart-shaped if you look at it from a cross-section, okay? And so the larger body is going to be important. It's in withstanding the weight against gravity, right? Maintaining your body weight against gravity, as well as just bearing the weight of the upper limb, the head, etc. Let's look at the sacrum. So again, 1 through 5, but these are permanently fixed or fused. Some of the features that we find in the sacrum altogether would be the anterior sacral foramina. This is where some of the sacral spinal nerves will exit to create the sacral plexus. We also have the transverse lines, which is kind of the mark where they were fused to become one structure. We have the sacral hiatus, which is the opening that exits, where those spinal segments will exit toward the coccyx. And then the entrance point to that is the sacral canal. So the sacral canal is the entrance point to this tunnel, and then the sacral hiatus will be the exit, all right? And then we also look posteriorly, and we have the posterior sacral foramina, which again is where those spinal segments are coming through and exiting to form that plexus. Also, we have the auricular surface. So the auricular surface is where we have the articulation with the sacrum in the middle and the iliac bones on either side. So we talked about the iliac bones last week, where we have the auricular surface of the ilium, and then that articulates with the auricular surface of the corresponding regions of the sacrum to form the sacroiliac joint. All right. Looking at the coccyx more closely, so it's really the ending point of the sacrum. It forms a joint called the sacrococcygeal joint with the coccyx. It is basically 3 stacked vertebrae, really small vertebrae, that are permanently fixed or fused. And it's sometimes called a tailbone, in layman's terms. Let's look at the hyoid bone. So the hyoid bone is really in the neck or thoracic region. One of the unique features is it does not articulate with any other bone. The function of the hyoid bone is to maintain the shape of the structures like the larynx and to keep the muscles of the neck region, the strap muscles, keep them in place, muscles that are really important for production of voice, etc. Now, the hyoid bone has the lesser horn anteriorly and the greater horn posteriorly. It has a body, and internally, the body has this curve again, we have muscles articulating on various sides, and from the top, called the suprahyoid muscles, and some below called the infrahyoid muscles. All right, but those muscles keep it in place. It does not connect to any other bone. Let's look at the sternum. The sternum is often called the breastplate or the chest plate. It has three parts: the manubrium, which is this bow tie shaped region at the top. It has the body, which is the central portion, and then it has the xiphoid process, which is the pointed projection at the end. Now, the manubrium is going to articulate with the clavicle, right? The collarbone. We talked about the collarbone when we talked about the pectoral girdle last week. So the collarbone articulates here at the clavicular notches, and that is going to form the sternoclavicular joint. So we're going to find the clavicular notch, and then centrally, right? So there are two clavicular notches on either side, and then centrally the jugular notch at the middle. We also want to think about the landmark where the manubrium meets the body as the sternal angle. This is important clinically as well. So this becomes a landmark where several structures happen. So the arching of the aorta happens, the entrance of the superior vena cava happens. And so that can be used as a landmark to conduct surgical procedures and clinical procedures, right? Really important landmark. Let's look at the ribs. So the ribs are forming the thoracic cavity. We have three different categories or types of ribs. The first 7 are called true ribs. Now, these are going to articulate directly to the sternum, right? And so they are what we would essentially call a true rib or authentic rib. The other 3, so ribs 8, 9, and 10, are going to be called false ribs. They don't have a direct connection to the sternum. They articulate via the costal cartilage of rib 7. So they kind of hitch a ride on the costal cartilage of the 7th true rib. And then rib 11 and 12 are going to be called floating ribs because they don't attach to the sternum or the costal cartilage at all, right? They're just kind of floating and hanging around there. Another fun fact here, the floating ribs can sometimes be injured, right? If you have a car accident, these are usually the easiest to be injured. And then on the left side, they are particularly dangerous because they can puncture the spleen. So it's really important to assess patients that have rib fractures, for any puncture wounds to the internal organs, right? And rib 11 and 12 can be really common for that. Let's look at the rib features. So looking at the head, we talk about the head articulating to the costal facet on the vertebra, the thoracic vertebra only. And then we talk about the tubercle as well. So the tubercle is this sort of bump or projection on the upper lateral aspect of the rib. And this is what articulates to the transverse process costal facet. So if you look at this articulation here, the head goes to the body and the tubercle goes to the transverse process. So that really secures the body of the rib and the transverse process, the body of the vertebra and the transverse process of the vertebra to the rib itself. We also have the body or shaft of the rib, which is really the rest of the rib as it takes the turn. And then we have the costal groove internally. Now, the costal groove is going to be a groove or depression on the inner lower margin of the rib. This is for the intercostal vessel, so the intercostal artery, intercostal vein, and nerve. We'll talk about some of those structures in the lab in year 2 when we look at the thoracic cavity. But these vascular structures create this depression, and this is called the costal groove. And then we have the costal cartilage again, which is what articulates it to the sternum. And this can be either direct if it's a true rib, or it can be via the rib, cartilage of rib 7 if it is one of the false ribs.